incentive spirometry, or more commonly known as IS. We will talk about what it is, the indications, the contraindications, the complications, and the outcomes. So what is IS? It's a simple form of lung inflation therapy that uses a sustained maximal inspiration maneuver. It is used in the treatment and prevention of atelectasis. Equipment needed for this form of therapy includes the IS device, the 6-inch corrugated tubing, and the patient's mouthpiece. IS devices can generally be categorized as either volume or flow-oriented. Volume-oriented devices actually measure and visually indicate the volume achieved during the SMI maneuver. Flow-oriented devices, on the other hand, measure and visually indicate inspiratory flow. This flow is equated with volume by assessing the duration of inspiration or time. Today, we will be using a volume-oriented IS device. Indications for IS therapy include upper abdominal surgery, thoracic surgery, surgery in patients with COPD or a smoking history, the presence of pulmonary atelectasis, or restrictive lung defects. Contraindications to this form of therapy include a patient who is unconscious, a patient who is uncooperative, a patient who is confused, a patient who has a vital capacity of less than 10 cc's per kilogram or less than 1/3 of their inspiratory capacity predicted. In other words, they are unable to generate a deep breath. Complications of IS therapy include hyperventilation, discomfort due to pain, hypoxia when interrupting the patient's oxygen therapy, a flare-up of bronchospasms, or extreme fatigue. We will now see an example of how IS therapy would be explained and performed with a patient. Please keep in mind that you should have already gathered all of your equipment and use 2 patient identifiers. You should have also washed your hands, put on gloves, and positioned the patient correctly. Semi-foulers would be ideal. Prior to IS administration, it is important to assess and chart your patient's vitals, breathing pattern, and listen to their breath sounds. Okay, Mr. Carrillo, so this is your incentive spirometer. Have you done it before?
Only once, but I don't really remember.
That's okay, we're gonna do it again today, okay? So this is the mouthpiece. You're gonna go ahead and make a tight seal with your lips on this. Breathe out first, and then you're gonna breathe in. As you breathe in slowly, a nice deep breath, okay? You're gonna keep this little float between these 2 arrows. Now we have a goal that we want you to reach today. It's gonna be right here as indicated with this blue little indicator. You're gonna breathe in until you reach it. After you breathe in, you're gonna hold that for just 5 seconds. So count to 5 in your head, okay? Then you'll exhale. Sounds good?
Yeah.
All right, go ahead. So create the tight seal. That was very good. The only thing that you didn't do was hold your breath, so I'm gonna have you do that again. After the patient has correctly performed the maneuver, instruct them to perform the therapy 6 to 10 times every hour. Make sure to assess the patient's performance and coach them if needed. Also, remember to encourage the patient to cough. When documenting in the patient's chart the predicted goal volume and the actual volume obtained. Don't forget to report any abnormalities with this therapy. Outcomes of IS therapy include improvement in abnormal breath sounds. It also includes a decrease in the patient's pulse rate, respiratory rate, and an improved breathing pattern. IS therapy will also provide better oxygenation and would improve the patient's vital capacity and inspiratory capacity.